Take it away, Jeff.
Good morning. This is Jeff Weinberg, President of Caregiver Champion, and we are continuing our series on important people or resources that are in the community that people should know about and connect with in some way. I am very pleased to introduce Anthony Goreczny, and he is the professor of Chatham University's graduate program at Chatham. And I had the pleasure of finding out about him. It's been over a year now. And as soon as we met, we instantly admired each other. And for him to admire me is really amazing because not many people do.
Not true.
So I figured if he admires me, I might as well put him on the video. Anyhow, Tony has a very, very amazing background, and he also is doing so many wonderful things, not only for the students at Chatham, but for the community as well. And he is a truly dedicated professional in the field, and I'm proud to have him come aboard and have an opportunity to interview him. So with that in mind, we'll turn it over to Rachel.
Absolutely. Ditto everything that Jeff just said. Thanks for joining us today, Tony. Let's start by hearing a little bit about your background. What are you a professor in? What is your role at Chatham, and how did you get into the psychology world?
Thanks, Rachel, and thanks, Jeff. And I first of all have to say I'm humbled by all of that. It's really just amazing, and I'm so fortunate to have the connection with the two of you. I remember our lunch and how we made that instant connection, and I'm looking forward to the constant for the future work that we're all going to do together, because I think we've got some great things together. So a little bit about my background. I am Western Pennsylvania born and raised. I still a strong Steelers fan, strong Penguins fan. They should never have gotten bounced from the playoffs as early as they have the last couple of years, and believe it or not, I'm still a strong Pirates fan. I remember going to a 1979 playoff game and a 1979 World Series game, and very exciting times for those back then.
I was in the 60 World Series last
Were you
night.
at the 60 World Series?
I was. So, but I'm not as dedicated as a Pirates fan as I used to be. But
well, I still like it.
That's another story.
So I grew up in a little town about 100 miles north of here, came to the University of Pittsburgh for my bachelor's degree, had some fantastic mentorship, ended up going to Louisiana State University in Baton Rouge for my master's and doctoral degree in psychology, and interned at Brown University Medical School, after which I got licensed back here in the state of Pennsylvania. And I've been licensed back here since 1990. I was blessed to really have some great mentors, both in graduate school and on internship. And then subsequently, when I came back to Pennsylvania. Like all good Pennsylvanians, my wife and I moved away for a little bit, and then we moved back. And I've been at Chatham since 1999. I started the graduate programs in psychology at Chatham, was the first director of the program, had some fantastic undergraduate colleagues who initiated the process. And then I came on board to be the first director and initiated the idea of bringing together a PsyD program here at Chatham. And so we've now got a large number of students who really are going out and working on social justice issues and helping to promote community throughout the Pittsburgh area. It's been an honor to be a part of that.
Amazing. From a psychology perspective, can you talk about social isolation and the effect on the patient, whether it's in a nursing home, people that are home alone, or on family members that aren't able to be with their loved ones right now?
Rachel, I'd like to ask Tony one more thing about that. Why did you choose the psychology field, Tony?
You know, that's funny. It's a great question. When I was an undergrad, I really honestly didn't have any idea what I wanted to go to school for. I just knew I wanted to go beyond some of the things that I saw happening in my rural community. And when I knew I needed an education for that. When I came to Pitt, I had actually, when I was in high school, I had a fantastic class in my senior year. There was a combination of psychology and sociology. And I thought, you know, I liked psychology. It really resonated with me. And so I came to Pitt and put my major in as psychology. And the first couple classes were okay, but really I started resonating with a lot of the stuff that was coming through. And then I had my first year roommate was a philosophy and economics major. And so I thought, well, I'm going to add philosophy too. So I ended up with a dual major in psychology and philosophy. And you'll appreciate this. When I was in my first year of college, my advisor, she said, you know, there's these new things. I hear they're going to be big at some point. They're really not right yet, but I hear they might be big at some point. You might want to take a class in computers. That is a true story. And it's true. I think we were writing in stone tablets back then. So I ended up with a minor in computer science as well.
That was good.
It was very good.
Wish I had that. So, okay, so going back to what Rachel asked, and this is very important for what I do, the whole issue of social isolation because of COVID has just become terribly isolating, depressing. People that are in nursing homes haven't seen their family members in 6 months. And not only that, but they're isolated from the people in the nursing home that they congregate ate with and things like that. But just as much as in the nursing home, there are many people today who are in their home alone, and they can possibly get out, but they're really afraid of doing that as well. And the whole idea of social isolation and the fear of getting COVID is just overwhelming. And everybody does it differently. My wife is very cautious. I've worked in hospitals all my life, so I'm not as cautious, but I am respectful of what she wants. I'm also respectful that I'm 73 years old and I need to be cautious. So from a psychological perspective, you're the perfect person to talk about this.
Mm-hmm.
Well, I appreciate that. And I want to give credit to a dear friend of mine, Dr. Al Condalucci. We've talked, I think you and I've talked about Al a little bit previously. And Al always talks about this notion of social capital. And what social capital is the friends, the contacts, the community members that we know that are there to assist us and provide support for us and be friends to us and just be around us. And that's really an important concept. And many people who are older, many people who have disabilities, or what I refer to as differing abilities, often have less social capital than those without disabilities. And the younger folks who have naturally built-in communities where they go into schools with their kids or going to work and have work environments. The reality of the situation is for those who are older, and COVID has just COVID has just really increased this for both older adults and for people with disabilities. The data out there is really kind of sad. And as a faith-based person and as a scientist, one of my favorite sayings is, "In God we trust, all others must have data." And so the data out.
Computer background.
What's that?
That's your computer background.
That's my computer background, exactly. And it's
Okay.
my Christian background. And I'm blessed to have a wonderful wife of 35 years and 3 great children. And the data that we have shows that, and again, the numbers can be a little bit different from study to study, but older adults, and I'm kind of quickly approaching that moniker, but adults over age 59, of those who are over 59, 43% of adults over 59 report significant feelings of loneliness. That's important. That's a significant.
That's a huge number.
It's a huge number. And what a lot of people don't realize is that loneliness is a huge risk factor for both physical and mental disease processes. A lot of people only think about it from the mental standpoint, but it's got significant physiological and physical components associated with it. When people are lonely, there's a 29% increased risk of cardiovascular disease.
Wow.
There's 64% increased risk of dementia. There's a 26% increased risk of death. And again, the numbers might vary a little bit, but these numbers show that it's significant. There's an increased risk of depression and suicide. And what a lot of people don't realize is that suicide, although everybody talks about it for teens and young adults, and it really is significant for those groups, among the largest percentage of people who commit suicide are older white males who've lost somebody and now are lonely and have prospects of really significant psychological pain. There's also a significant increased risk of medical visits, higher utilization of medication. For those who are living on their own, there's a higher risk of entering a residential or nursing care facility. In many ways, some people have likened this loneliness, and these numbers are staggering, have likened it to smoking 15 cigarettes a day in terms of its increased risk for high blood pressure and the onset of disability. That's staggering.
Yeah.
Some people have often talked about it as equally significant to obesity. And so when we think about those kinds of factors and the importance of community, it really is important, this loneliness, that we do something to help prevent loneliness, especially among older adults. And I'll give one quick personal story that I'll recall. My wife a few years ago said, you know, let's go down and visit her father. Her father was living in Florida. So over the Christmas holiday, my wife and I and the kids, we went down and visited my father-in-law. And at one point, my daughter asked my father-in-law, "So, Granddad, how you doing?" And his response was really sad and predictive. He said, "I'm kind of lonely, and I'm just waiting to die."
Oh.
Very sad. Within 4 months, he was dead. And that is a kind of a predictor or kind of a story of what often happens to older adults. And what's really sad is that older adults often have great experiences that we can utilize to help with increasing community opportunities and utilizing those skills to help younger adults and a group of people such as people with disabilities or differing abilities to make those connections that they might not otherwise make.
Absolutely.
So first of all, and I've been in the field probably longer than you have, but that's the statistics are like hard to digest.
Yeah.
And
They are, aren't they?
yeah, and really people, we put on such an emphasis on the medical aspects of whatever people are experiencing, but nobody or few people ever pay attention to what you just said in terms of even from a medical assessment. You know, how do you spend your time? Do you feel alone? And those kinds of things. So
Yeah, in
what do
fact,
you,
I think one of the most important questions a healthcare provider can ask is just what you said. How do you spend your time? How do you feel? How connected are you with people? I think you hit it right on, Jeff.
So,
well, you know what, as I'm saying it, I don't do that always myself. So I'm glad we're having this conversation because it's really an eye opener. So what do you suggest as a way to deal with all of this
yeah, that was going to be
situation?
my question as well. What are some things that people can do if they are feeling lonely and isolated to, find some light in all that's going on?
Well, and really, this COVID pandemic has created an increase in loneliness. And in fact, a friend of mine who is a funeral director has said he has buried more people in the past 3 to 4 months due to suicide and overdose, drug overdose, than he did in the previous 3 to 4 years. And so really the key thing I think we need to do is we need to make sure we reach out and make connections with people.
Mm.
And and it's not just a superficial connection. It is a true, genuine connection that honors the experiences of all people. And an example of a way to honor those experiences is identify what the people are that are lonely have to offer. They have many skills and many talents that often get put aside because of their age or in the disability community, because people see the disability as opposed to the abilities that people have. And when I teach classes, I write up on the board disability. And then I say, I want you to think about what that means. And then I erase the word or the first three letters, DIS. And I say it's really important that when we are assessing individuals, that we look not just at the differing abilities that they have, but at all of the true abilities that they have. All too often, people only see the disability, and then they write the person off, or they see the person's age and they go, you can't stay up with me, you don't know about the technology. And the reality of it is, here we are Zooming, and I'm entering that older adult age group, and utilizing the newer technologies, and I'm using some of the other technologies that are out there as well. And Jeff, you are as well, and Rachel, you're helping us along with that. And so I think that really it's a matter of identifying what are the abilities that each person has, and how can we utilize those abilities to help people who are in need of other kinds of activities.
Mm.
I just love what you say. I mean, it's really heartfelt, and it's very eloquent. But we have to make people aware of what you just said, and hopefully, I mean, I get about 10 people that look at my videos, so we can at least make 10 people more aware. And if you put it out and Rachel puts it out, but we have to do this. I don't know if you know this, but my mother-in-law, who was 97 and in a nursing home, she actually died because she was a failure to thrive. She just sort of like what your father said, or your father-in-law. She just gave up, and she quit eating. She quit getting out of bed. There was just no purpose to her life, and she died of social isolation. And
That
I
surprised me.
and I actually have called that the second pandemic. I mean, we put all of our emphasis on the COVID, and we need to and we should. But once again, we're not dealing with how that affects the person from a psychological perspective.
I agree, and in fact, I would say there's your comments really raised kind of three thoughts in my mind. First of all, when we see the graying of America, this is and the graying of the world, if you will. This is, as you mentioned, a second pandemic. It's a really significant pandemic when we're going to see the graying of America even increase rapidly over the next 20 to 50 years. And as that happens, we really need to put in place mechanisms to honor our older adults, to honor the kinds of experiences that they have, and to utilize their skills to help make our whole entire society even better. I think that aging population is significant. And I feel sad because I have a mom who's 98 and I can't get into the nursing home to see her. It's really bothersome. One of the good things about Pittsburgh, and I just love this community, we talk about the 7 degrees of separation between people. In Pittsburgh, it's more like 2 or even 1. And Jeff and Rachel, I know when the 3 of us got together for lunch, there were so many connections that we had with various different people, some of whom have passed on, some of whom continue to bless us with their presence. But it was amazing how many connections the 3 of us had that we never even knew about. And I think that's one of the strengths of Pittsburgh, and we need to utilize that strength as a recognition of making that community even stronger.
Mm.
That is so true, and it's so important.
Yeah.
And we take it for granted. I think that's the other thing. And by raising that awareness, which is what you're discussing, it puts it back to where it needs to be, which is that you can't take those things for granted. You have to make the effort to reach out.
It's got to be a planned, active process, because otherwise, much like many people with disabilities, our older adults will be among the forgotten. And that's the last thing I think we want.
Absolutely.
Absolutely.
Yeah. It's an important conversation. Thank you so much for being here and talking about this with us. We know that you're involved in a lot of other things outside of just being a professor. What are some of those things? What are some of the projects that you're working on right now that you'd like to share with people?
Well, there's both within the profession and outside of the profession. Inside of the profession, I am the principal investigator for a project called Independent Monitoring for Quality. And one of the things that we look at is how do we improve the quality of life for individuals with what we refer to as intellectual disabilities, or again, what I refer to as differing abilities. We've got 3 of us on the Zoom meeting here, and each one of us have differing abilities. You do some things that I can't do, and perhaps there's 1 or 2 things that I can do that I'm maybe a little bit better at that you can't. And the reality of it is that's true for people with intellectual disabilities as well. And so we go out and we interview about 700 people a year. This we will do via Zoom. Hopefully we'll have that opportunity to continue. And we identify what it is that they want in their life to help improve their quality of life. Not surprisingly, far and away, one of the most important ones, no matter how they say it, no matter how they express it, one of the most common responses among all the people we interview to help improve their quality of life is improved relationships and more relationships. That doesn't surprise me one bit. And that's one of our goals, is to help really improve that area. And so one of the things and in fact, I think that's one of the areas where we can really improve the work that we do, is match up maybe some of the older adults with people who are younger with differing abilities as a mentorship type of program. How cool would that be? It then provides usefulness for an older adult who may be looking for some meaning in their life that maybe has passed for some of them. And it provides great opportunities for younger adults to learn from the experiences that are so valuable. So that's one of our one of the activities that I'm engaged in. Another one that's academic is the opportunity to, I've been blessed with the opportunity to really look at how neuropsychological, I'm not a neuropsychologist, I'm a health psychologist, but I'm on a team with a group that includes a neuropsychologist, looking at how how we can assess cognitive and motor and human systems performance functioning via the web and via apps. Traditionally, it's been done, traditionally it's been done via in-person testing. And with the pandemic, there was, with technology, that was already moving in the direction of doing stuff on the web and via apps. The pandemic has only heightened that. And it presents really unique opportunities for people who are isolated to identify kind of where some of those challenges are. And it also presents opportunities for people who are living in rural communities who might not have the resources available in their community. So that's another really exciting opportunity that I've got.
Amazing.
Outside of Scouts, one of the things, or outside of my professional thing, my professional affiliations, I'm actively involved in the Boy Scouts of America, and we've got just fantastic opportunities. And a lot of the people that I work with are older adults. A lot of the people I work with have differing abilities, or what some people refer to as disabilities. And one of the things that I've been very proud about with my affiliation with the Boy Scouts of America is that the entire time that I've been a part of it, we have always worked towards inclusion of all peoples. And we've extended that even further with no differentiation between genders. And I don't just mean male or female, I mean non-binary as well. All youth are now able to become Eagle Scouts, which I think is awesome, and to advance through the ranks of Boy Scouts. And so that's one of the neat things that I'm doing outside of my profession as well.
Amazing. We're running out of time here, so I want to wrap it up and let people know where they can find out more about these amazing things that you're involved with. And thank you so much for sharing your beautiful spirit and knowledge with us today. We appreciate having you.
Thank you.
Where can people find more about some of these programs that you're involved with, or just learn more from you?
Well, I think if they if they Google www, or just go to www.chatham.edu and search for my name, or go under the graduate psychology programs, I'm there. My email, people are more than welcome to email me. My email is my last name. It's a good, easy name, Goreczny. It's spelled just as it's pronounced. It's my last name, which is GORECZNY at Chatham, CHATHAM.edu. And I always look forward to working with people and making more connections. It's just like I've made those connections with the two of you, and I'm so blessed to have the two of you in my life.
Well, we're grateful for the relationship and connection to you as well. Thank you so much for sharing your time with us today.
Thank you.
Tony, you've been I didn't realize, because it's been so long, how much I really enjoy speaking with you and how much you inspire me. And
and I look forward to our getting together and breaking bread again.
Well, you owe us a lunch, and
I do, and I haven't forgotten.
And you didn't have to go to the extreme of creating this whole COVID thing to get out of lunch.
Well, I was waiting to see if I could extend it a little bit, but I'm hopeful that I'm really looking forward to the time when the three of us can get together and physically distance. I don't use the term socially distance, because during this period of time, we actually want to be more socially connected to eliminate the isolation. or to at least decrease it. But I use the term physically distant. So I look forward when we can get together, even if it's physically distanced, and have some lunch and break some bread together.
Well, I'm going to truly make an effort, because you've been raising my awareness, to try to reach out and see if we can get together, just if it's this way or whatever, because I miss being involved with you.
Well, and I
really
miss it as well. I'm looking forward to the future. I think we've got some great things we can do together.
Well, you're terrific. And
Yeah, this is a really important conversation, and unfortunately not one that I'm hearing a lot out there. So thank you so much for being a part of it and bringing some of these points to.
Thank you for inviting me to be a part of this.
Rachel's now in the master's program in social work, and this is an amazing conversation for her to
Very important.
inspire her to keep going on. And she's going to be very good in what she does, because she's a very caring, and she gets it. She knows what the world's about and what she'd like to do to help it. And that's part of the reason why I like working with Rachel. And as you said, she also was the introduction to me into social media. And the first time we did this video, I couldn't say my name without stuttering. So
I
now
find that hard to believe, because you are so well spoken.
well, when you're on camera, it's a little different.
Well, and
This is true.
I love what you said about, you know, the importance of matching being inclusive and matching all ages. There's so much to learn from each other. And I have learned so much from working with, you know, Jeff and meeting you. And that is something that I hope doesn't change from COVID. I hope that those relationships, you know, can.
And race and ethnicity and sexual orientation, and when we look at people's varying religious experiences, we need to come together.
100% agree.
Especially in today's world.
I agree.
Yeah.
Thank you, Tony.
Thanks.
Thank you both.
Marvelous.
Until next time.
Looking forward to it.
Take care, guys.